Welcome to yet another episode of Embody TV. I'm Helen Z, and today it's a pleasure to host the lovely Nikki Haak, who is a naturopath and natural fertility educator. Now, we can find that it gets really quite difficult to disseminate the information of what's out on the internet versus what is right, what's not right, what should I be doing, not doing. Mm-hmm. And today it's great. We're going to have a frank conversation with Nikki.
Yeah.
We'll have a great conversation with Nikki, and we're going to get into the guts. It's like you're sitting here being consulted in a particular way where you get to know the ins and outs and get to feel what's right for you. So if you don't have a pen and paper, give yourself a moment. We'll wait. Get yourself a pen and paper, because I'm sure there's going to be a lot of information here that you can jot down for yourself. So by introduction, Nikki, being a naturopath and natural fertility educator, helps couples to get healthy prior to conceiving, giving themselves the best chance at a healthy pregnancy for yourself as well as your baby. And not only that, it's also supporting women postpartum and also supporting families as well.
Yeah.
So it's the whole kit.
Yes, it is. It is the whole kit.
Beautiful. And Nikki, tell us what brought you into the niche of working with fertility via naturopathy?
Okay, so I was studying naturopathy, and I was a mature student, so I was in my sort of middle to late 30s, and I met my partner later in life, and we had children. We started having children later in life, and so I was 38 when I first had my first child, and as a result, there's a lot of challenges that come with that, being an older mum, and trying to fall pregnant being an older person. So I did a lot of research while I was studying around that, and obviously I fell pregnant naturally, which was lovely for me, and I had a natural birth. I subsequently went on to have 2 other children, and my last child I had when I was 43, would have been 43.
Wow.
So an older mum, and at 43, when you have those initial blood tests, it was a high risk of there being something not quite right with my third child. Luckily, everything's worked out now, but there were some challenges at that time. I also was working at a clinic in fertility, and learned a lot around natural fertility and IVF, and supporting couples undergoing IVF, as well as trying to support couples whilst taking the more natural path, or in combination as well, which is often the way. That's how I came into it, through my own journey, essentially. Yeah.
And Nikki, it's so important what you share here, because we are seeing more and more women putting off for whatever reason, whether it's not the right partner or a career choice,
that's right.
And circumstances, and trying to enter motherhood later on in life.
Yeah.
And true. So in this journey from even you being 38 to 43 years old, you've managed to work with your body, work with your natural fertility, as well as through assisted therapy system about what might be possible.
That's right.
Even though you conceived naturally, but I'm sure that you would have potentially thought that you may need to think about it and go down that path.
Yeah, that's right, definitely. Yeah, certainly. And quite frequently I have couples coming in to see me who have been trying for a little while, maybe that's a year or 2, trying to fall pregnant naturally, and they may at the same time be also investigating the IVF pathway, and just wanting to get themselves into the best possible health prior to investing in IVF. And we always hope that we can help them along the way so that they can conceive naturally. That's not always possible. I do recall one particular client that had been trying naturally. For whatever reason, we couldn't get that to sort of happen, and then she underwent IVF and had a successful birth and a beautiful little boy, and has subsequently fallen pregnant naturally. So often that can happen too. The body knows what to do. There's a trust in one's body that comes with having done it before, and things just flow.
Yeah, wonderful.
Yeah.
And there's a story of hope there. And what I'm hearing and what I'm hoping that you're receiving from this as well at home with you watching is the main key here is taking an inventory of your life and your natural health and vitality.
Yes.
Because irrespective of whether you're using assisted therapies or natural therapies, we still need to take care of our body and our environment. And these are some of the things that Nikki's going to be sharing with us in detail. Nikki, tell us, what do you feel is missing in the assisted reproductive therapies?
Okay. So some of the things, when people go through or seek out assisted therapies, it's because they're having difficulty falling pregnant. So there's some element of infertility. And infertility is a symptom of something else going on. And unfortunately, IVF doesn't always come up. Some of those symptoms, are not always necessary to treat with IVF, and that could be that the lady doesn't understand her menstrual cycle, doesn't understand when her fertile window is within her menstrual cycle. She may not be ovulating regularly. Her cycle could be just irregular, and there's no particular sort of flow in her hormones, and so she's unsure about when that fertile window occurs. Also stress can be a huge component, certainly falling pregnant, as well as during IVF. So IVF is a very stressful time for couples, and really finding ways of managing stress and connecting in with your partner during that time can really make you feel supported and hugged as such, for want of a better word. So stress is a huge thing with IVF, and that support structure that comes around that.
Yeah, I love what you say about feeling hugged, because in my experience with women and couples, I find that what's missing through the fertility journey is losing touch with intimacy. And that just adds to the stress. And it's a culminative effect that we're wanting to make love and have sex and intimacy to try and bring this child forward, but we feel like it gets out of our body and out of reach, and it's just yet another thing that we have to do. And that just affects the quality of the relationship.
Correct. Yes, that's
and so bringing all that back together is just so important, to just keep empowering women and couples to go with the journey and have fun. Have fun throughout the journey.
That's right, exactly. And couples do report that it feels a bit, I do this here and I do that there, and a bit process driven versus relationship driven. So
Nikki, World Health Organization is saying that in Western society, there's 1 in 4 people, and it's also in Australia as well, that are experiencing infertility. What do you see through your clinic doors? What do you see through your doors with people?
There are a lot of couples that come in that are struggling to fall pregnant. And the main things, or the main reasons that I see behind that is our particular lifestyles. Couples are, or females in particular, are choosing to, go through education, go to university, establish their careers. They're buying properties, they're investing in things, and so they've got debt. The expectation of women has changed over the last 30-40 years, and so women are finding relationships a little bit later in life. They're making choices that are right for them, and therefore by meeting their partner later in life, they're also choosing to have children later in life, and that's part of what is going on in our lifestyle. And with that advancing age comes egg quality and sperm quality concerns. So that is what happens. Their environment, so there's lots of changes in the environment in terms of the amount of pesticides and plastics and technology that we're exposed to. And there's increasing research around the impacts of those things on egg quality and particularly sperm health. Sperm are particularly fragile, and DNA can be affected very easily through exposure to plastics and computers, mobile phones, etc. Yeah.
So leading on from there, Nikki, what are the prominent health conditions people present for treatment in your practice?
So the main ones are, you get your couples, females that have got polycystic ovarian syndrome or endometriosis or fibroids, to name a few. But the other ones that I see are unexplained infertility, so irregular cycles, women not understanding their menstrual cycle and how the menstrual cycle is really a true guide of a woman's health. And knowing when that fertile window is, and it actually occurring when it needs to occur to maintain a healthy pregnancy. I find stress is a huge driver in many of these cases, and couples, understanding their perceived levels of stress and how that has an impact on the flow of their hormones and being able to address that. It's really quite significant. The other thing that I see coming through the door is women who have been on like the pill or Mirena or IUD and are having trouble re-establishing regular cycles, and helping them to re-establish those cycles so that they can get their hormones back under control and get an understanding of their own natural cycle again, that is not chemically induced.
So important. What protocol would you generally use for a woman and or couple that you are working with?
Okay, so sperm and eggs take around about 3 months to mature and develop. So ideally, we're talking in terms of preconception care between 3 and 6 months, and that gives a practitioner like myself an opportunity to talk about diet and lifestyle advice, stress management, and environmental things to be mindful of, things like plastics and personal care products, cleaning products, use of mobile phones and putting them in your pockets and those sorts of things. We have lots of discussions around those things, and also working with men. So as I said before, the sperm is highly susceptible to damage. It also makes up 50% of the genetic material of the baby, so it is equally important that a male goes through the same type of preconception care. Some of those things are, stopping smoking, stopping drinking, eating, healthy food. So that, what does that look like? That looks like, eating good sources of protein every day, lots of vegetables, good fats, and good fats that comes from, things like deep ocean fish, avocados, nuts and seeds, your olive oils, coconut oils, nut and seed oils, raft of different sort of good oils, and don't be scared of fats. Fats are important. They make up cholesterol, and cholesterol is what is the precursor to hormone. So you do need cholesterol. It's all about the balance, the balance between good and bad. As I say, the Goldilocks effect. Not too much, not too little, just right.
And if you're at home and you're unsure about what your diet consists of, and if it is nutrient dense or not, or if the fats that you're getting are good quality fats or not, reach out to a dietitian or a naturopath. Contact me and I'll have the details below. Nikki will also have her resources below, and just keep in touch. These little changes may make a big difference. This is what we're talking about here today.
Every little
changes we make today are going to give a cumulative effect of the health of your egg and your sperm 3 months from now.
And also, talking about the cumulative effect, it's also about your child's reproductive health and their child's reproductive health. It has a flow-on effect for generations. So what you do today will only help future generations in terms of their ability to be healthy and to also be able to have children.
What results can a person expect if they go through a naturopath and start making some healthy changes to lifestyle, which, as you said earlier on, doesn't only include diet and the quality of water and the food that you have, but also minimizing plastic exposure to chemicals and trying to limit the amount of electronics that you have around close contact with your body.
That's right.
So what would someone expect?
Yeah, so you would expect after making these changes that you would feel a lot more healthy within yourself. You would look healthier. You'd have a lot more energy and the right type of energy at the right time during the day. And that your menstrual cycle, from a female perspective, would be flowing just as it should. And that is often a really good indicator of how things are, going within your body. As a naturopath, we also look at nutrients, if there's any nutrient deficiencies that could be causing any issues. We look at different aspects of your health. That can be, digestive, or it could be immune. It also could be some thyroid concerns, to name a few. Often being a healthy weight is really, or not often, it is important. Being overweight is no good and often impacts your ability to ovulate. And being underweight means that your body won't allow you to fall pregnant as such, because you wouldn't be able to maintain a healthy pregnancy. So finding the healthy weight is really important.
And Nikki, you bring up a really good point, and I'd like to flesh this out a little bit more here today. And I know, talking to you prior to even doing this interview and the work that you do, you do look at and ask clients, women, about the quality of their blood.
Yes.
Because the quality of our blood, when we actually look down on our particular cycle, we're able to determine what changes we need to make to be able to have better health. It is a marker. When you know how to read your blood, you know how to read your body. And what I mean by that is that if your blood is dark in the first day or so, really, really dark brown, a little bit gritty, has some clots, and also at the end of your menstrual cycle, that's a form of stagnation. That you've got a stagnant blood in the uterus, which can make implantation harder. So it doesn't mean that you're not getting pregnant, but implantation is not taking place effectively long enough to be able to sustain that pregnancy. The second thing with that, which you touched on with healthy weight, is that when you're blood deficient, symptoms of your blood can be orange, clear, very fluid-like, watery, pink, and sometimes having pink clots. And there are some women that I work with where their blood has got an orange tinge. Not rarely seen, but it does happen. So I encourage you at home that to start tracking and monitoring your blood and the quality of your blood, because if it's not approximately a 4-day bleed where it's oxygenated and nice and red and rich and flowing, and it's not marked with the clots and the stagnation, I highly recommend that you go and get those symptoms and start working with them. So blood stagnation, deficiency is what you help with as well.
So when someone comes in to talk about their menstrual cycle, they're the sorts of questions that I would ask the client. What does the blood look like? Is there any clots? What sort of symptoms do they have premenstrually? Do they have any pain? What's the type of pain? There's lots of different sort of investigative questions, and that helps me as a practitioner to determine what are the best nutrients, what are the best herbs to use to encourage that flow or to address that nutrient deficiency that may be there. And it's it's really important as a female to understand your body and your cycle, because not only does it help you in terms of fertility, in which what we're talking about now, but it also helps you to understand if that's my normal cycle and something happens during a cycle that's not normal, you go, that's not okay, I need to go and investigate about that. So it really is important that you know what is your normal cycle and what does that look like.
Yeah, beautiful. And I know that you're also quite big at getting people to do some blood work, and that you work with the optimal ranges of what the bloods come through.
Yes.
Because I'll get you to elaborate on that actually. Nikki's the expert here. I know that you do work with pathology work as well, and the importance of this, because this leaves our viewers with some of the things that you can do for yourself in this preconception phase.
Definitely. So part of the preconception work would be getting some blood tests done as an initial sort of baseline as such, and often the results will come back. Doctors will work within ranges that the pathology companies send through. However, as naturopaths, we work more along optimal levels. Okay, so everyone is different. As naturopaths, we treat everyone differently and accordingly. And though, because we work towards more optimal levels of nutrients, it means that people see better results as a result of working that way.
Wonderful.
Yeah.
Wonderful. And some take-home messages if we're for planning for preconception. If you'd like to leave a couple of take-home messages for our viewers.
Yes, certainly. So the main 5 things that I would say to you to take away from today would be to really understand your menstrual cycle and understand when your fertile window is. And that may be that you need to, get a book that talks about that, or come and see a practitioner like myself that can really help you to nut out what your cycle looks like, or try and address any things that aren't quite as they should be within your menstrual cycle. So that's the first thing. The second thing is to get yourself into a healthy weight and exercise and get outside and, be healthy. The third thing would be stopping smoking and drinking, and choosing your nutrition particularly well. So choosing good protein, lots of vegetables, good fats, drinking water. So replacing soft drink with water, lessening the amounts of cups of tea and coffee that you have, and replacing that with herbal teas or water. And with your vegetables and meat, trying to buy organic where you can. It is expensive to buy organic, but it is worthwhile when you're certainly trying to conceive, just to make as much of an investment as you possibly can in organic foods. We did speak the other day about
the Dirty Dozen.
And the
Clean 15. So there's a website link that I'll put down below, and what that demonstrates is there's studies that have shown that these particular Dirty Dozen do have a lot of pesticides in there. So if you do have some spare organic dollar cash, go for those. And if you don't, it's okay to not get it organic, but please wash your fruit and veggies really well and store it really well.
You can buy fruit and vegetable wash from the health food store, so I would invest in that at the very least, or even some vinegar and water when you're washing your vegetables. The other thing is to look at the sort of products that you're putting on your face and your body, and washing your clothes in and cleaning your home with. All of these things are chemicals, and the cumulative effect of all of these chemicals in our body is no good. So where you can choose natural alternatives, in your health food store, there are a wide variety now of cosmetics, shampoos, conditioners, body washes. There's a lot to choose from.
And we're even finding that in supermarket lines as well.
That's
it's
true.
Becoming more and more affordable.
Yeah, it is becoming more and more affordable.
Beautiful.
So, and also those sort of ambipur, those synthetic fragrances, stick away from them. They're estrogen mimicking, and they disrupt your body's natural hormone balance. Instead, choose essential oils as your fragrance,
Great.
essentially,
Great.
and things to burn in your home.
Wonderful.
Yeah.
Excellent. And if I can add to that, so viewers, I will have just down below the 5 top things that Nikki and Nicole has said. And just know that if you are here and you've written all this down, give yourself 3 months for any changes that you're incorporating to see that change and track that change.
Yeah.
From my perspective, if I can add a couple of things in there, men and women, connect with your body. So women, especially your breast area, it is a big part of our reproductive health. The brain, the breasts and the uterus form a beautiful trilogy. So just only focusing on what I'm doing, what I'm not doing up here, and actually forgetting that the brain is a beautiful sexual organ which flushes the body with all the hormones that you need for everything to work beautifully and succinctly. A lot of breast massage and just coming into flow and rhythm in your body.
Mm-hmm. Yep.
And men, just exercising, cardio is great for you. Connecting also with your penis and your testes. Give it a nice big massage, oxygenate the area, making sure it's soft and supple. Mm-hmm. And also have fun with your intimacy. Mm-hmm. It's only about a 25% window over a 3-day period of the month. Yep. Where we hone it in trying to get that right timing. The rest of the time, try and build on the honeymoon effect.
Yes. Yeah.
What got you together? And if you're a woman on the journey on your own, you can still do this with your friends, with things that you love, whether it's art, reading, theatre, whatever it is. Just come into that honeymoon effect of being able to fall in love with yourself all over again, because your bodies are the first place and home that your little tiny baby is going to occupy.
Yeah.
So take your time, open your pantry and slowly take out what you're willing to replace it with. Nourish yourself, knowing that you're on the journey of nourishing yourself in preparation for nourishing your little baby.
Yeah, definitely. Yeah. And it also sets you up really well when you do that, for really good practices for your children.
Absolutely.
In terms of feeding and supporting your children. So.
Thank you so much for your time today.
Thank you,
it really does feel like
that was really great.
We've been in a consult here, and I really do hope that you've got something out of this. Reach out to us below if there's any way that we can help you online.
Definitely.
We're both willing to do that, and let us know how you go. So thank you very much, and we will see you next week.